Hi, my name is Slade, and today I will be discussing delayed onset muscle soreness, also called DOMS. Have any of you ever weightlifted and felt great afterwards, but then experienced muscle soreness later that night or the next day? If so, then you have experienced delayed onset muscle soreness, also called DOMS. Symptoms of DOMS are experienced 8 to 48 hours after exercise, and these symptoms will gradually worsen and peak between 24 and 72 hours. The effects can linger up to 7 days. Muscle soreness experienced immediately after exercise is considered acute muscle soreness and is not correlated with delayed onset muscle soreness. It was previously believed that lactic acid buildup was the cause of delayed onset muscle soreness, but now it is known that that is not the cause. There is no definitive reasoning of what causes DOMS, but there is two leading theories. The first theory is that it's caused by microscopic damage, which is then detected by pain receptors in the muscle fibers and which sends pain sensors to the brain, which is followed by an inflammatory response. The second theory is DOMS is caused by a neuromuscular response. Previous studies have shown that the mental state of individuals, such as if they're experiencing depression, anxiety, or if they have negative mental state about lifting, then the symptoms of DOMS will be worsened. There are many factors that can affect DOMS, such as the intensity of the exercise, returning to exercise after an extended break, training program alterations, but the major factor that increases DOMS is lifting during the eccentric movement, which is when the muscle is lengthening. During this form of muscle contraction, the muscle fibers are under an increased force, which causes more damage. The severity of soreness is not correlated with the effectiveness of the workout, but it is often thought so, which is why there's the saying, no pain, no gain. It is important to decrease the severity of DOMS because it will decrease muscular power, endurance. There are many ways to avoid and minimize DOMS, such as progressive overload, dynamic warm-up, active recovery, and by improving recovery through nutrition, hydration, and sleep. Progressive overload is gradually increasing the volume or intensity of the training program. This allows for the muscle fibers to become acclimated to exercise, which will reduce the effects of DOMS. Active recovery involves low-intensity exercise such as swimming, jogging, walking, cycling, or stretching. This will result in an increased blood flow and improved recovery. There are many nutrition and supplements that will affect the severity of DOMS. Caffeine in doses of 5 milligrams per kg of body weight has significantly reduced DOMS, but this is above the daily recommended intake. Amino acids such as glutamate has also reduced the severity of DOMS. Omega-3 fatty acids, which inhibit the inflammatory response, and taurine reduces oxidative stress markers, which cause muscular atrophy. Thank you for listening to my presentation.